So I think Jack's already introduced me. I won't go through too much. I'm still a practicing orthopedic surgeon, and REMCARE is a product of a desire within my own clinical practice and a few of my colleagues to streamline perioperative pathways to make it much more patient-centered and more efficient. And I'm grateful for this opportunity to present in front of you. I'm also very grateful for Barry Lambert from Birmingham Children's Hospital, who's the lead anaesthetist there for preoperative care, who'll be talking about the REMCARE implementation in Birmingham Children's. And also, we're also joined by Maggie Babb, who is the anaesthetic lead for the West Midlands Surgery in Children Operational Delivery Network. So I'm going to set a quick scene about what problem REMCARE is solving in perioperative pathways and how it can help in provider systems in streamlining the pathway and increasing the productivity while improving patient outcomes. And then followed by Barry, who's going to talk about the local implementation of REMCARE in Birmingham Children's Hospital. And following that, Maggie is going to talk about the West Midlands Surgery in Children audience ambitions of having a cloud-based regional platform to streamline the perioperative care for children across the whole region. So while REMCARE can cater for adult and children's perioperative care, this talk, we're going to focus on the children's side of the whole situation. So if I can start off by defining the problem we're trying to solve in the form of a case study. Please meet Jack. He is, Harry, who's a 7-year-old boy who's on the waiting list for a tonsillectomy. Unfortunately, he has got a long wait ahead of him. And during this wait, his condition deteriorates. He is visiting his GP for several antibiotics. He's also visiting A&E on a number of occasions because of worsening episodes. And all of this causes severe anxiety to the child and the family, several days of school, days of work for the family. And Harry is getting quite sad with this. Now, most children's, the APA, Association of Pediatric Anaesthetists of Great Britain, stipulates that every child should have a pre-assessment before coming in for surgery. And the situation in the West Midlands is that a lot of hospitals do not have a robust pre-assessment service for children. And in those hospitals where there is a pre-assessment service, it is often short of capacity. And Harry, as a result, doesn't get a pre-assessment before his surgery after a long wait. And he ends up on the day of surgery with severe anxiety, which requires a physical restraint, and all that leads to a very poor patient experience, but also causes delays in theatre because of the anxiety issues, and in turn, theatre utilization problems. So effectively, there is no significant harms review currently in most systems to detect whether patients are deteriorating while they're on the waiting list, which affects patient outcomes. And there isn't enough capacity in pre-assessment services to prepare every child for surgery. And where there is a pre-assessment service, most systems have, a same pathway for every child, regardless of the risk profile. And this is really not customized to the risk profile of the individual child, which leads to unnecessary appointments for low-risk children and a high and resource deficit for those like Harry who absolutely need the service. So how does this pathway look with REMCARE? So what can good look like? So essentially, once Harry is put on the waiting list, if a hospital is using REMCARE, we can pull all this data about Harry from the trust IT systems through an integration, or pending the integration, the whole waiting list can be bulk uploaded on REMCARE, which is a web-based platform with a patient app and a hospital dashboard. So as soon as this waiting list details are entered on REMCARE, the platform already automatically sends an SMS and an email with an activation link for the REMCARE patient app, which the families can use to log on to the REMCARE app. They can also use the NHS login credentials. We're already integrated with NHS PDS Spine, so the data is validated. And once the patient and the family get onto the REMCARE app, they fill out a detailed questionnaire asking about their condition and their health status. And the unique aspect with REMCARE is, compared to any other system which can collect patient information remotely, is the algorithms on REMCARE automate some decision making, in that they can automatically look at all this the data and risk stratify patients into not only just low to high risk groups in terms of their health status, but also any pre-optimization issues in the case of Harry, an anxiety issue, or even some health inequalities. And all these questionnaires and the risk stratification can be customized to local hospital specifications. On the app, Harry and his family also get useful information in terms of the procedure, counseling for anxiety, all of that is available. And following that early risk stratification, which will guide any proactive interventions to prepare this patient, this is followed by 3-monthly contact with the patient, where a separate set of questionnaires are sent out, which are specifically customized for that individual specialty or condition, so that in this instance, any deterioration Harry has noticed in his condition can be again automated. And this is again displayed in a patient timeline in the appropriate color-coded dots, so that even non-clinicians can notice that Harry's condition is deteriorating, so that this can be highlighted to non-clinicians, to the clinical teams, who can prioritize Harry, so that Harry is waiting less time than a routine patient. And of course, shared decision making can be made available on Harry, and we can integrate. We've already integrated with Patients Know Best, and we can integrate with any patient engagement portal or any other sort of trust EPR systems. Now, in this instance, the system has highlighted that Harry doesn't have any significant health risks in terms of the anesthetic risk, but there is an anxiety as an issue. So the booking teams can adopt a smart booking process where Harry can be diverted to the play therapy team and doesn't really need a full pre-assessment, which saves on the capacity issues in the trust. And that can in turn help with increasing the productivity, where the sparse booking slots are really used to give appointments to those who actually need the pre-assessment. So in this instance, Harry is appropriately prepared, and he comes into theatre with the appropriate anxiety counseling. So he goes through the whole theatre episode with less trauma, and he has a much better patient experience. And of course, remote monitoring after surgery can also be conducted on REMCARE. So you can prioritize the follow-up appointments depending on the needs of the patient and their recovery. So essentially, REMCARE is a cloud-based digital perioperative assessment and management solution, which has been co-designed by clinicians and patients, and the West Midlands Surgery and Children Audion has been heavily involved in designing this as well. So this is a system which allows an early anesthetic risk stratification of patients at the point they put on the waiting list to help identify pre-optimization issues, followed by regular 3-monthly contact to highlight issues which if the patients who are deteriorating on the waiting list, to help with clinical reprioritization. And REMCARE is essentially also a robust electronic preoperative assessment platform, which provides the full preoperative assessment workflow for the pre-assessment nurses to complete the whole pre-assessment and improve the productivity in the service, while streamlining the whole pathway and improving patient outcomes. And this is all very much in line with NHS England mandate for early risk screening and preoperative and regular follow-up of patients, of the patients on the waiting list. And of course, it complies with the NHS England and also the Association of Pediatric Anaesthetists of Great Britain and Ireland guidelines. So I won't talk too much about the results, because Maggie and Barry can talk about their local sort of implementations, but essentially the early risk stratification allows the booking in line with the risk profile of the patient in the pre-assessment clinics, and potentially there is a opportunity to get the lowest risk children through a fully digital pathway, which can significantly release the capacity for increasing the productivity. In terms of the waiting list optimization, you can have cleansed waiting lists based on whether the patient really needs to be on the waiting list or not, and also a harms review, which helps in clinical prioritization. And some early evidence from Birmingham Children's Hospital has also shown a 7% increase in theatre utilization compared to pre-REMCARE and post-REMCARE in terms of minimizing the late cancellations and on-the-day cancellations due to clinical needs. In terms of the health economics, York Health Economic Consortium have conducted a health economic assessment, which shows that for every £1 invested in REMCARE, there is a £7 efficiency gain achieved. So we're fully compliant with DTAC and all the UK CA markings as a software as a medical device. We're on various procurement frameworks. And essentially, the ask for this forum is to help us in scaling REMCARE across all the hospitals in the Midlands. to achieve a standardized and streamlined perioperative care for children's pathways to not only help local productivity issues, but also standardize the pathways across the whole region and also help with mutual aid. Thank you so much.